Yes, yes, yes. Okay. So hopefully we're going out to our audience who are assembling, I've noticed. And so welcome to everybody who's joining us for this webinar. It's very exciting. We've got people coming from all over the country, different universities, different organizations, different professions, which is great. I think we have over 250 people booked, and we've got a great lineup of speakers as well. So as you know, the session today, the webinar, is called Communicating Health and Creating Supportive Environments, and particularly about talking about health. It's really bringing together that. So that's what I'm gonna just to say. My name is Robin Landsman. I'm an AHP, I'm an osteopath, but actually also a trustee of the Institute of Health Promotion and Education. And I'm going to be chairing the event today and bringing our 4 fabulous speakers together and introducing them in a few moments. But first, if I may, I'm going to introduce Laura Binney, who's the head of the Robert Gordon University. Thank you, Laura.
Thank you, Robin. Thank you for. Good evening, everyone. I'm Laura Binney. I'm Head of School of Health Sciences at Robert Gordon University in Aberdeen. I'm absolutely delighted to open this evening, this event tonight. First of all, let me start by saying how delighted that the School of Health Sciences have been invited to host this webinar in partnership with IHPE. And secondly, I'm absolutely delighted to welcome an increasing number of participants tonight in this online event where we can explore ideas and learn together. I'd also like to take this opportunity to congratulate IHPE on its 60 years of supporting professionals in the field, and I'm actually delighted to be part of this occasion during its anniversary year. I'd also like to thank everyone at IHPE in planning this event, as well as the team within the School of Health Sciences at RGU, so thank you. And finally, to the wonderful panelists who have given up their precious time for tonight's event, so thank you for that. Good to get some of the thank yous done at the start as well, and I'm sure Robin will do that at the end too. But we're in a meeting in an online environment tonight rather than in person this evening, but this really does allow a wonderful opportunity to connect and communicate together from near and far. RGU, in particular the School of Health Sciences, was actually one of the first in Scotland to develop fully online courses in health promotion. Since 2008, we've actually recognised the need for practitioners to access learning resources in ways that fit flexibly, in busy working lives. The innovation was to build learning around online conversations, bringing people together from widely diverse settings and channels and contexts to share and learn from one another on the principles of supporting professional practice. So as well as developing specialists in health promotion and public health, the school ethos actually within the Health Sciences School at RGU is to thread health promotion across all of our courses, including physiotherapy, diagnostic radiography, dietetics and occupational therapy, and I know that will form some of the discussion later this evening. Additionally, we've been absolutely delighted to be in a position to provide upskilling short courses in public health and health promotion. This is a Scottish Government funded project that's enabled us to provide funded places for those working in the northeast of Scotland as well as across Scotland, looking at postgraduate learning opportunities for people working in the health and social care sector, and also for those who are looking to transition into the sector too. Connecting people and learning conversations has always seemed the best way to enable the complexities and the context for health to be explored. Thinking about health as a positive concept, socially determined and experienced unequally across different groups and communities. This aligns with the work of the IHPE, and we're absolutely delighted to come together in partnership for this webinar. So tonight is a time to learn together, explore together, and connect together actually, and I'm very much looking forward to a lively event tonight. I'm going to hand over to Patricia, but just before I do so, I'm just going to run through some housekeeping. I hope everyone is hearing us okay. If there are any technical issues, please just use the chat box or email elearningshs@rgu.ac.uk. As you'll have seen, the webinar is recorded, and shortly after the event, we will make it available through the IHP website as well as the RGU website too. There was also opportunity to submit questions when registering. There are no other questions to be answered this evening, but if there are anything, if there's anything in the chat, that will hopefully inform conversations for future webinars. So I hope you enjoy your evening. Thank you very much. Delighted to be here, and over to you, Patricia. Thank you.
Thank you so much, Laura, and good evening, everybody. I'm Professor Patricia Owen, and as President of the Institute of Health Promotion and Education, I'm absolutely delighted, along with Laura, to welcome you to our webinar held in partnership with our good friends at Robert Gordon University. I'd like to thank those who've worked tirelessly, and I'm going to do the same, Laura, I'm afraid, to set this webinar up. So thank you to trustees within the Institute, our colleagues at RGU, as well as our distinguished panellists, without whom none of this would be possible. As Laura said, we're celebrating 60 years of the Institute's work, and this webinar kickstarts a series of events and activities that we're undertaking to mark the occasion. For those of you not so familiar with the Institute, it was founded in 1962, and we're looking well on it, aren't we? In fact, its inaugural meeting was the 28th of April 1962, so we're almost exactly 60 years from that point, which is marvellous. The Institute remains dedicated to improving standards in health education and promotion, and sharing expertise and research with like-minded professionals. And this is undertaken through the publication of our journal, the International Journal of Health Promotion and Education, publication of our newsletters, we publish evidence-based position papers, and of course, share expertise, share research, share opinions in events like this. So it's always beholden on me as president to say, if you are considering joining us as a member, do take a look at our website for further information.
Great.
In the 1950s, before the Institute was set up, health education was concerned with delivering healthy messages to individuals and populations, centred around how to make those attractive and eye-catching to people. And I was having a look through some of the early journals, and one of the papers in the Institute's journal outlined how to construct a folding display and exhibition stand to deliver those health education messages and information to groups, which is a far cry from the immediacy of social media messaging capabilities that we have at our fingertips today. Later, when the Lalande report, and many of you will be familiar with that, was published in 1974 on the health of Canadians, there became more interest, as Laura has said, in how the social and environmental factors affect people's health, and what actions could be taken to ameliorate the negative effects. We know the World Health Organization's publication of the Ottawa Charter in 1986 formed the basis for the development of health promotion and education since then. And the strategies outlined in the Charter of advocating for health, enabling for health, and mediating for health are fundamental to our activities for health promoters today, and correspond to some of the areas that Laura talked about. And so those principles from the Ottawa Charter stand us in good stead today in order to consider how we can further progress health promotion, how we can develop social justice for health, how we communicate for health, and how we create healthy, supportive environments. And certainly for the discussions this evening, how do we talk about health? And so with no further ado, Robin, I'll hand back to you and look forward very much to the discussions this evening. Thank you.
Great. Thank you both very much, Laura and Patricia. We'll see you later. Thank you very much. So gonna get in now into the meat of things, but actually just to briefly introduce, I mean, you've read the introductions hopefully on the bookings, but I'd like to introduce, should we start with Fiona MacDonald, if we may? So Public Health Scotland, and particularly into health promotion, and started actually, I think, in dietetics. Is that that's a short intro?
Thank you, Robin, and good evening, everybody. Patricia's talking about 60 years ago, but I was an RGU student 30 years ago in one of the former buildings, Laura, when it was an old health science school on Anderson Drive. And what takes us into health? I guess I'm sitting listening to Patricia talking about the Ottawa Charter, but I'm also thinking about where I had opportunity to work, which was in the West End of Glasgow in a disadvantaged community, and in Old Swan, a neighbourhood in Liverpool, in an early part of my career, and just knowing that something beyond that setting wasn't right. There was individuals there that were living within communities that were connected to something, but often disadvantaged through choice, and those choices were influenced by jobs and housing and other things going on, that in a dietetic clinic, when you're dealing with issues, you never quite got beneath the surface. So I'll say no more than that, because I guess that brings me fast forward to why I do what I do today, with a 30-year journey in between. But there's something about the wider determinants of health and society that sits right in the middle of all of that we're all dealing with.
And the
Thank you,
passions and
Robin.
drives, don't go away. That's the point.
Don't go away.
That's
They don't go
the
away.
very, that's the big key.
Absolutely. Absolutely.
Thank you for that. And Sylvia, well, former president of the IHPE, do you want to introduce a little bit about yourself, just to give me a sure.
Well, I've been a member of IHPE since since the early 90s or mid 90s, and I was the immediate past president before Patricia Owen. So my sort of role now, I'm almost retired, but not quite. And I'm more involved in local NHS services now, but originally my passion for health promotion came through dental public health. When you sort of think about health, and the major sort of tenet of health promotion is inequality, and within dental health, inequality is huge. And almost all dental ill health can be prevented, but it isn't, because of the inequalities that are attached to it. So that's why I'm passionate about it. I've been involved 30 years, maybe a little bit more, in health promotion.
Okay, so lots of experience. Thank you very much. And who we got now? Denise, should we just go to you? So, in fact, you are one of the educators at RGU, teaching lots about health promotion to undergraduates and postgraduates. Do you want to give a little bit more?
Thanks, Robin. Good evening, everybody. As Robin says, I'm Denise, and I'm academic team lead for public health at Robert Gordon University. Sort of similar stories to the other panelists around why I got interested in health promotion. I trained as a nurse around 20 years ago, and at the time, I suppose, very kind of focused on sort of the medical model, I would say, and actually sort of speaking to patients and exploring reasons as to why patients were sort of readmitted. I started to really think about sort of social influences on health, and that kind of really piqued my interest in health promotion. And then I've had a journey through various roles, and then came to RGU again as a student myself, and then have ended up working there.
That's, you see, everyone's got a lot of experience and observations on what they saw and what they want to do about it, which is really great and empowering that that's going on. Linda Hindle, can I have a little bit for you? You've got a long title, so I know you're Chief AHP, is that correct? OHID.
Yes, I'm one of 3 Deputy Chief Allied Health Professions Officers in England, but my kind of lead area is around public health and prevention for the AHPs, and I work in the newly created Office for Health Improvement and Disparities, which is part of the Department of Health and Social Care, and is the new home of part of what was Public Health England. So that's part of my role, and the other part of my role, as you were suggesting there, Robin, is supporting the emergency services, so police, fire and ambulance services, to increase their contribution in public health and prevention. But interestingly, I'm a RGIT graduate as well, and I was just wondering if I was there at the same time as Fiona studying dietetics. So sorry, yeah. So why I got interested in public health and prevention. So I'm a dietitian by background, and for the majority of my career, I worked in community dietetics, health education, obesity prevention, and that led me on a kind of I suppose a twisty journey into being part of a public health team, and then moving to Public Health England.
Wow, and what might be useful later is to chat a little bit about how the fire service, ambulance service, police, how that links in to some of the questions we've got. Yeah. Now, is there anyone I've missed? I don't think so. I think we're ready to go. So I mean, obviously you've explained a little bit about, I think, what health means to you, but maybe who would like to go first to chat a little bit about what health means to you? You've explained it in terms of your experience, and some of the passion. Is anyone willing to add a little more?
Well, I'll jump in first, Robin, because mine will be the shortest and the simplest, because I feel that my more academic-based co-panelists will have better insights than I have. For me, it's just important to say up front that it is not about the absence of disease, and it incorporates all physical and mental health. And I think it's important to understand that there's an optimum level of health for different people at different stages of the life course. And there is not one descriptor of what is health that would fit every scenario. But I'd very happily hand over to Linda and Fiona and Denise to come up with a better set of words than that. Thank you.
I'm happy to come in on the back of that. And Sylvia, your point about the definition, we often get asked about that, and it's a difficult one. I guess the thing that's in the forefront of my mind, thinking about the world that we're in 2022, living on the back of COVID, is that mental health and well-being and resilience is absolutely central, to all that we do, and it's got an even stronger position now and probably needs to be strengthened alongside our physical health in the absence of disease, which is a change in state. So it's not an either or, and I guess into that space is about our ability to adapt to change and bounce back or maintain that level of resilience when there is so much moving on round about us that does have an impact on our health.
Yeah, I mean, I wouldn't add much to that, but I think as you were suggesting there, Fiona, we saw through the pandemic, didn't we, the importance of social connectedness as part of our emotional well-being, and I think the only thing that I'd add that we haven't said, above kind of the physical, mental, and social well-being is that sense of being valued and having a purpose in life, whether that's purpose through employment, through social connections, through giving back, through learning, in whatever way. But I think it's that kind of overall kind of bringing together of all of those elements.
And Denise, do you have anything to add?
Thank you. I think I agree with all the points, and just to add that health is very individual to the individual themselves, and I think, as Sylvia said, that can change, across the lifespan, but also it can change on a day-to-day basis as well, is what is important to that individual about their health.
So maybe I can bounce back. How do we, in the quite often medicalised model of training in healthcare, how do we kind of enhance that communication, two-way traffic? Is there any ideas you've got on that? Because clearly that's perhaps the way in to understand the individual a bit better. We are talking about individuals and day-to-day change, which is really hard for a big system to look at. How could we encourage that to be better? Anyone want to come in?
So I think we focus much more on the biopsychosocial models of health now, and also what is important to the individual when we're thinking about individual person-centred care.
Okay. Do you want to break down, I understand the term, but biopsychosocial, how would you kind of define that more simply?
Yeah, so just looking at the wider influences on health, so instead of just looking at the medical or the illness aspect of health, looking at the other influences, so the social influences of health, the psychological influences, and the social health. So really what's going on for that individual, and what is influencing their life and their lifestyle at that moment in time.
So lifestyle medicine, to use a phrase, to some degree. Yeah.
I mean, Denise has picked up about the individual. I guess it's also, there's something about us stepping back as the expert, potentially, and I'm going to bring that into the space because there's something about equity and parity here, and bringing people's voices into the space of the lived experience, and actually really, I think you challenged us at the start, Robin, tonight to really listen, but to really listen to what makes a difference and what matters to people, because often, and I guess there's a challenge to ourselves in this, we can bring assumptions and we can bring things that we think we want to do into a space and to fix, and if we do that and continue to do that, that is going to widen the inequalities gap even more. So there's something about you're really empowering people to come with us on a journey, or us with them on a journey, because there's a lot of, I guess, you know, drivers and barriers, that levers and drivers that we need to sort of, you know, increase, but equally barriers that we need to sort of take away or to mitigate, to make life better for people.
So setting the goals, sorry, so setting the goals, yeah, according to the needs of people, or their perceived needs, as well as what we assume about them. I just wondered whether, I mean, Sylvie was about to come in with something, so I'll just.
Yeah, I think in my head, to me, that is about recognising sort of an asset-based approach. Nobody chooses to be ill. Nobody chooses to have a poor level of health. And we know that there's a lot of social determinants that create inequalities in health. But as individuals, everybody's got some assets. So it's about taking a glass half full approach with the individual. And I am talking about sort of looking back to when I did actually, you know, work with groups and individuals and communities, but seeing where they are now, where they're starting from, and helping them find the solutions, rather than telling them that if they do this, this and this, they're going to be very healthy. So it's a real asset based, because that works for everyone, recognizing where they're starting from and building on what they've already got.
Okay. Anything else anyone wants to add to that, Linda?
Yeah. I was just kind of reflecting while Denise was talking about sort of, you know, the biopsychosocial model and how important that is in education, but reflecting back that often when we are training to become healthcare professionals, because we're trying to kind of tick the boxes of what we're being marked for and the different healthcare conditions and what you need to know about them and what you need to what information you need to get across in relation to different health conditions, it's very easy to move away from that, what matters to the individual and what do I need to tell them, which of course, and you see that I think as we kind of start to specialise as healthcare professionals, that we start to focus on one part of the body and not necessarily kind of stepping out of that and thinking, well, how does this individual live their life? What does matter to them? Is this, you know, what's going to be practical? And I think that's something that it feels to me that that's the sort of conversation that's happening more now in healthcare than it did previously. But I think we've got a long way to go still to really work from a strengths-based, assets-based approach.
Can I bounce this question to Denise, if that's okay? Because we've got, I think what Linda was saying, correct me if I'm wrong, is that, I wouldn't say struggling, but there's a lot to learn to be a health professional. There's a lot of information that then you feel wedded to, that you want to put that across. Sorry, I'm muted myself. So the question would come then to the undergraduate, perhaps, how do you put about that idea of how much learning is needed to still put across this message and make this connection as a communicator with your client patient group?
Yeah, so the public health and health promotion is kind of threaded throughout our undergraduate programme. So kind of built on as the students kind of go through the course, and they get the opportunity to put what they've learned into practice and see the challenges of that when they go out on placements as well at the undergraduate level.
Well, I mean, someone's just brought up just now, one of the audience, in fact, about bringing health promotion as a matter of, you know, general need into all courses, because if it's not in there to teach that link between the knowledge you're learning and what needs to be delivered, then there's a gap. there's something not quite happening.
Definitely, and I would put forward an argument that public health should be in all, well, not all, but a lot of university courses. So thinking about things like architecture, for example, and the importance of planning, towns and cities, and thinking about how we can plan for health throughout, and not just be focused on sort of the allied health professionals or the traditional sort of health professional backgrounds, but thinking about public health and all the professions that contribute towards it.
So is that Fiona?
Yeah, no, I was just going to say something I think that's quite dear to my heart also, in terms of what you said, Denise, is that public health isn't just owned by public health people, it's owned by every one of us. And I think the challenge we have all got to do is to kind of unleash that enthusiasm in whether you see yourself as a profession or you see yourself as a member of the community or a member of the public. There's something in it, back to Sylvia's point about assets, there's something that everybody's got to bring. Now, some people are closer to that maybe in terms of their knowledge base, but in terms of experience, there is a huge amount that everyone has got to contribute. And you see that coming through much more when we think about the systems that we're all, we're all operating in organisations. We all are interdependent on each other. And people are living within communities, and there's again back to how we strengthen some of those ways of working, and that understanding about what the shared outcomes are as well for communities is really, really important.
I'd like to bring Linda Hindle in just for a sec on this, because I think one of the things we have mentioned or spoke earlier about the ambulance, fire brigade, police, that might link up right now actually to talk about how that could be part of community working.
Yeah, absolutely. I mean, Fiona and myself both have some kind of work with the police, and I think they're a really good example of where, if you start thinking back to not so much kind of what are the direct issues that we're dealing with in each of the different sectors, be that health inequalities, social inequalities, crime, vulnerability. If you start moving back to what are the causes of those symptoms, then we start to be looking at the same things. So it is about kind of, community cohesion, it is about poverty, it is about inequalities. And we're working with the same vulnerable communities, using the same public purse in the same geography, and therefore it makes absolute sense that we work together. We might have ultimately different outcomes that we're trying to achieve, but the drivers are similar, and that's why it makes sense to work together. So the work I do with police is looking at some of the common agendas, such as mental distress, drugs and alcohol, adverse childhood experiences. For example, with the fire service, it might be again drugs and alcohol, it might be smoking, it might be social isolation, it might be cold homes, and with the ambulance sector, again, we might be looking at falls, we might be looking at mental health conditions. Drugs and alcohol again keep coming up, but they are a symptom often, aren't they, of something else. And so that's why I think there is a kind of interwoven agenda where that kind of partnership working that Fiona was talking about is crucial.
Can I ask you a quick question just to bounce that back? Is how welcoming and I'm hoping these people you're talking about to actually join in and actually participate in these kind of slightly new ways of helping the community?
More than welcoming. They are back. Right. They are knocking on the door and flinging the doors open. So when I started working with the broader emergency services, it was because the fire service approached the NHS and they approached Public Health England to say, look, we can help you. We've got some kind of, I suppose, latent capacity. We recognise that we're working with the same people and we want to work with you, and same with the police. I think perhaps the ambulance sector, there's a desire, but there's kind of that massive pressure on the sector, isn't there, in terms of targets to get ambulances to people, and we're obviously aware of that at the moment. But still, there's a recognition that it's better to prevent than cure.
So can I throw the question to everyone about sustainability? Yeah, because a lot of these things we've mentioned earlier about things coming in ebbs and flows and disappearing again and not quite sticking. Is there something in all of this? Maybe someone else can take that, just to kind of look at that. How could does that help sustainability genuinely?
I guess part of the challenge is to think about, Linda's talked about prevention, and we're talking about that upstream approach. So to really think seriously about what we mean by our inequalities approach and how upstream do we really need to get, because we need to get much more upstream than we probably are at the moment, and we probably also need to stop collectively doing some things, and that's a quite brave decision when we're talking about some of the shared agendas. But we know from stronger evidence base and the work that's been going on over many years now, certain things have a better return on investment than others. So I'm being a bit provocative here, because I do think there are things that we do know collectively will make a difference. And also the other challenge, Robin, is that we talk about the sort of fifth wave of public health, and I don't want to get into the waves, but society is more complicated now. And I think our partners, we all need help to actually, particularly again, bringing back COVID, you know, thinking about where we are now in a global economy with jobs. And I was struck as we were talking about the Ottawa Charter, you know, when you go around some of the bits that hold that together, that almost needs reframed about, it's not employment and unemployment, it's about job security. It's about the quality of our working life. It's about so many big issues that are in that space.
So to talk about the possibles, I mean, there's lots of challenges. What are where might be, Sylvia, Denise, where might be the barriers to these linkages? These where is it financial? Is it practical? What's the issue? Because clearly that needs to happen. It sounds like.
I think there's an issue about making sure that the policy makers across governments, and I know Linda in working in public health at the centre will know this, getting those policies across all other government departments and raising the profile of the importance of health promotion and health itself through all the other departments, and from there it then trickles on down. I do know probably 15 years ago there was a big push to get health impact statements into every policy that came out of a local authority before they did anything. I mean, I think that is embedded and is there now. But at the beginning, there was definite resistance to it because, well, you know, we're about roads, we're about housing. Health isn't really anything to do with us. And until you point out the reasons why, that actually this really is a shared agenda. But you probably also need champions and people that buy into it and take an interest in order to get it embedded at a strategy level.
So I might mention things like Health Watch and such organisations who are kind of connecting community with health services. Those sorts of organisations seem to be quite useful to link some of these things up and provide forums for that. Is that your experience, Denise, or anyone else? Is that something you've witnessed?
I'm not familiar with Health Watch, I'm afraid, Robin. So
No.
I couldn't really answer.
Well, it's interesting. There's an awful lot of people out there trying to do some good work. I think that's the point of what we're saying here, and it's linking things up, and it's that's an interesting point in itself. So we won't talk about that right now, but that's perhaps a case in point. There's an awful lot going on.
Yeah. The other thing that I'd like to add, I think, just building on Sylvia's point, is around sort of shared budgets as well, and not just sort of ring-fencing budgets for, you know, health per se, and also thinking about funding as well. And it shouldn't be, it's traditionally often been short-term funding, which means that projects and initiatives maybe don't have the opportunity to be evaluated and sort of evidence in the sort of the shorter time frames. So I think that can be an issue as well.
Yeah, and I would just bringing it back to you, Robin, that illustrates some of the differences between the UK countries. We have Health Watch in England. I don't think you have Health Watch in Scotland. You will have something similar that's just called something different, but Health Watch and those sort of organisations, they are more at local level. They can bring people together at place level, or for England, what's going to be integrated services level. But what I'm talking about is a real central strategic level to say we need to get health embedded into all the housing policies that go through, you know, transport, whatever it is, in all those different departments, to make sure that health is right there at the top.
Totally. Can I just go on a little bit, perhaps, into also the role communities can play, and also a little bit on intergenerational aspects as well, because I think there's some definite benefits to mention there. So has anyone got anything they'd like to talk about on that front?
Yeah, I mean, I was reflecting as conversations been going on about the theme of tonight, which is about communication, and knowing that you were going to ask us about intergenerational aspects of this, Robin, but I think language is really important. And I think one of the things that often comes through when we talk about intergeneration is it can be quite divisive. We can talk about young and old, or we can talk about in work and out of work. And either there's something in that we need to sort of just again step back and think a little bit more clearly about, because there is such a lot of richness to be learned. When I'm thinking back to pieces of work I've been involved in where you've got young people going into care homes. This is pre-COVID. You know, you're sharing a lot of learning, you're sharing a lot of experience. You know, grandchildren with grandparents. You've got you know, thinking about males, thinking about dads with children. There's so much to be gained in terms of some of that intergenerational understanding of health, and coming back to, you know, where some of the solutions and some of the assets are. That is really, if we're not careful, we could lose some of that, either intentionally or not, just in the language that we use and how we frame some of our approaches. It's trying to be inclusive rather than, you know, exclusive and divisive.
Absolutely. Anyone else want to come in on anything else on that, on the intergenerational community aspects?
Well, Fiona was just reminding me of that really lovely TV programme that was around a few years ago on Channel 4. It was the Old People's Home for 4-year-olds, I think, which was a really nice example of older and younger people learning from each other and each getting a different benefit, which I think, if you've not seen it, it's worth seeing if you can find that on probably on YouTube or somewhere, isn't it?
I think there's been a number of examples in England where provision for under fives is alongside provision for the elderly, and it just works absolutely beautifully. But there's so many barriers and challenges to doing that sort of thing, and COVID will have made it much, much worse.
I think what I just want to say is that our audience is sending in so many questions, I can't keep up with them. I'm trying to bear in mind asking some of my questions back based on what I'm seeing. But there's a lot coming in, which says a lot about the passion of a lot of people attending this meeting. And, you know, that's great to see. And perhaps we'll try and decant this down from all the questions that have come online, because it's almost a little overwhelming to take everything on board that we're trying to talk about today. So apologies if we can't cover everyone's point.
There was some comments just coming in, I just clocked there, about Indigenous populations, and I'm struck again by when we think about the global world, and I'm sure people on the call, I've got some experience of colleagues who've worked in the NGO world. I think, Sylvia, you talked about it at the start. There's a huge amount to learn when we go beyond, you know, the island nation of the UK, and we think about, and I'm struck again by, you know, we've just all come through mass vaccination programmes. In terms of approaches, when you look at how that happens across other countries in the world, I'm thinking about our breastfeeding rates. Previous experience I've had of, you know, breastfeeding peer support, where how we really start to address some of these health outcomes, which is with the communities at the heart of them, as opposed to coming from a, you know, an expert led or from a systemic, you know, policy. It's not to say that policy isn't important and health needs to be absolutely central with some strong leadership in there, but the communities, when they are empowered themselves with the right support, with champions and skilled worker practitioners.
Absolutely, and breastfeeding is a brilliant example that you know, nobody wants central direction around breastfeeding. You know, you want your peers, but the funding for it and the ability to set those things up in this country needs to come from the centre. But I would just remind everybody, Robin, with my IHPE hat on, is that our journal is the international journal, and a lot of our membership and networks are international, not just in the UK.
There's a lot of learning to be had from that. In fact, talking of learning, I just wanted to move on slightly into intergenerational, but particularly in schools. And since, you know, the curriculum is the curriculum, is there a way to encourage schools to prioritise time rather than necessarily even money or and so on into changing the curriculum in schools to enhance even more, and they do quite a bit already, to enhance that from an early age?
I think there's something about how we frame the conversation. So, I mean, again, I can think from a Scottish perspective, we've had health promoting schools as a framework to get some sort of you know, both operational activity and policy drivers. Linda will be aware we've had all the school meals initiatives, you know, in terms of feeding our nation. We've had lots of initiatives going on round and about. We've also, I think most recently where I saw it really come into effect is when we had the human rights-based approaches in our schools. So we reframe the conversation from a rights and respecting perspective for our young people, and that starts at an early age. So it's not necessarily coming from a lifestyle perspective about just physical activity and food and, you know, healthy lifestyles. That's important, but it's also got to be framed in the way about how we respect and value, you know, ourselves as individuals right from the start, and young people. I mean, if we think about our 12 to 24-year-olds and some of the vulnerability and some of the issues that Linda talked about, you know, in terms of the risky behaviours, not seeing that as a deficit, but trying to really reframe that in terms of how we respect each other as individuals, and that starts in our family centres, in our nurseries, and in our schools.
Absolutely. So encouraging perhaps kids to take on the agenda as well, to shape the agenda, yeah, rather than be told this is how it's going to be, perhaps. More inclusive.
Yeah, and I think health promoting schools started in Europe, I think I'm right in saying, and is progressed and has been sustained better in Europe than it has in the UK. But certainly in England, going back 10 years, the health promoting schools movement was absolutely fantastic because it was so well funded, and it was really broad in its approach, and it wasn't just about giving children information about health. It was really involving them in engaging them, and a lot of that I think has continued today. Most schools do have school councils, don't they, where you know, the children are involved, and school meals, you know, I think the quality goes up and goes down. But the sad thing for England is that most of the funding for healthy schools was withdrawn, and now it's a much contracted, smaller, less important priority. Although I do think most schools who were involved in it in the first place have continued because they see the benefits for the school and the children. But I do think we can learn from a lot of European countries on how to do health promoting schools as a setting really well.
So in other settings, if I can, sorry, Denise, I've interrupted you about to speak.
Sorry, that's okay. It might actually just relate to your question about settings, because I was just thinking about Scotland. We've seen quite a few community campuses come to the fore. So that's when there's schooling facilities on the campus, perhaps cafe, community centres, sports facilities and other education facilities. And I think that they really support health and well-being of the community as a whole, and also support different members of the community working together.
Okay, that's good. And Linda, I was going to say, is there anything on the greening agenda, that sort of mix? Is there anything coming forward from that sort of policy linking into health from your point of view?
Well, I mean, I think you've asked that because we've been doing work with the allied health professionals around the greener AHP.
Yes.
And I think one of the things that's become really clear in that, which I mean, it's not new, is it? But the inextricable link between environmental sustainability and healthcare. And I think linking that back to the schools agenda and you know, young people leading some of this agenda, that's an area where young people are really passionate about, aren't they, about the health of the planet. And you know, it may be that that's kind of one of the inroads into some of the broader health agendas that you know, young people might not be particularly interested in purely from a health perspective, given they may think about their own immortality, but from a linking it to the planet and an environmental sustainability may be of more interest. And I was just kind of thinking while Denise was speaking there about kind of that lovely community campus area of the sense of what we're kind of referring to as anchor institutions. So big public sector organisations and the responsibility that they have not only for delivering the services they do, be they healthcare services or policing services, but the broader role that they play in the well-being and economic prosperity and environmental sustainability of the area that they are in, through kind of the way that they procure goods and services locally, the way that they employ local people and provide good quality employment, etc. And so it does all kind of link back, doesn't it, to the conversations that we were having before.
So it's a bit more holistic, one might say, to use a phrase, but actually pulling things together from different domains. And actually also, I think what you're saying is trying to find things that appeal in slightly subtle or sort of slightly different ways than one would expect on taking on new health ideas and carrying forwards different healthy lifestyles. It's not the obvious way in sometimes, and perhaps even asking people and connecting with them might not always give you the true answer. It gives it an opinion, but actually somehow a lot is going on in that green agenda that can be kind of carry things forward as well on a wave, which is great.
I think you've hit the nail on the head there, Robin, in terms of, you know, we've talked about kind of public health as being really about partnerships and everybody's responsibility. And I noticed some of the comments in the chat were that, you know, other sectors kind of have got to deliver their own objectives and may not see this as their health as their priority. But I think it is that sense of kind of finding kind of where those areas of common purpose and those sweet spots are, and kind of nudging from that perspective, rather than, you know, sometimes I think we probably could all be criticised as kind of thinking, right, this is my agenda, who can I work with to help me solve my agenda, as opposed to what is our common agenda and how can we all get some benefit by working together.
But can I ask, how could we share that more outwardly? Because case studies are done, I've even done a couple myself a while back, and I kind of thought, how could we share good practice even more avidly, clearly, openly? Is there any ideas on that?
Some of the conversation we've talked about tonight is about who owns the agenda, and it's owned across the whole system. So there's something about, it's not transactional, it's not one way at all. So I'm struck as you're talking, Robin, about case studies, but there is so much we could do with a lot of testimonials and bringing people into the space. And the other thing it'd be sad to go off the call tonight not talking about digital and digital inclusion, because we are now living, and we have been for a long time, we've just been fast forward into it, particularly in the last 2 years. But we were talking about young people and adults, digital is part of our lives. It's not something separate and at a distance. So we need to get in and around using more of, I think, the digital spaces. We need to be opening up the conversations. We need to be breaking down, you know, the language barriers. And the other thing I was struck of, I think, just this week, I would encourage people to look at the Frameworks Institute report that's just come out 2 days ago, which starts to look at how we bring the wider determinants into our conversation, because we've not talked about the quality of housing, we've not talked about the quality of our working life, you know, in terms of the jobs that we're in and the protection we've got. But we know that is not the same for everybody in the country. There's many people, Linda's talking about anchor institutions, there's many people that are so far away from that we've got a job to do to connect people, either through digital or through some of the policy levers, to much more into bringing their story to life. That's not simply just a case study on paper.
Anything from Denise and Sylvia on that you want to bring back in?
Well, it comes back to getting health promotion policy into all policies and recognising, yes, that because health isn't created in hospitals, health is created in the wider community. But just one thought, Fiona, around digital. I mean, I think COVID, particularly in primary care, and this is the one area where I still do some work, COVID has just pushed the digital age fantastically, and in a lot of ways it's been really so useful for everybody, and it's there to stay. But for some sectors of the community, and I'm thinking about people with disabilities, with learning disabilities, etc., it's actually disadvantage them even more. So I think we must be really, really conscious all the time that the use of digital can actually have huge implications for inequality for some sections of the population. And as long as we're really aware of that as we go forward with it, I think it would be awful to create a new inequality, wouldn't it? We've got enough already.
Absolutely. But during the pandemic, I think there was one of the questions that we had was really, it's changed the needs for communication about health. There's no doubt about it. It's also, I think, between health professionals and the public, there's been a shift, I think, a more awareness of that change. So is there anything anyone wants to say on that? What any lessons learned in a sense for how we can carry forward some of what Sylvia was just saying to make these connections work better?
Yeah, I think communication, really need to think about who our key audience is and what it is that we're communicating, and we adjust our communication to that audience. And I think we've really seen that come to the fore with COVID, and, you know, some of the briefings that were done from Number 10, and, you know, how some of the data and things were presented to make it interesting and engaging to the, you know, the general public. As well. So really thinking about our communication and who we're communicating to, but also I think has been mentioned as well, that we're not increasing inequalities because not everybody has the confidence or the access to, you know, digital technologies. And something else I think you're maybe a way to come on to later, Robin, is around health literacy as well, and making you know, sure our messaging and people's understanding of our messaging is clear.
So in terms of something like health champions, something like that, any ideas then on how to use them more, better, to actually make a bigger impact?
Sylvia talked about primary care. I'm thinking of community link workers, and the huge investment that we've seen. Now there's lots of different, they come in different guises, but in essence, community connectors between services and communities, and you know, to bring, as Denise is saying, to bring that real message into the space and to help people navigate the plethora of services. So Sylvia's just about to shake her head. I'll hand over to you, because that is just a minefield of trying to help people, you know, even ourselves navigate the system. But
absolutely, and I can remember 20 years ago working with GPs in Liverpool who had lists on their computers of where they could socially prescribe and send people off to, because really they were in their surgery not because they were ill, but because they had other issues. But of course they couldn't possibly keep up with everything that was available. So those link workers or social prescribers, they've got different headings in different places. I think they're a really valuable tool, and they help their communities. And within that, let's not forget about actually peer groups, wherever they are. I mean, going back to breastfeeding, you know, where you have peer groups supporting mums, that always has a much better outcome than one professional trying to visit 24 people. So yeah, it's about bringing those communities together and supporting them and making sure that the funding is there to do that at a local level.
Anyone else got anything else on that? I just wanted to talk about health prevention and self-care, because I think what has come up quite heavily is obviously you can encourage people and you can also train them in a sustainable way, in a sense, to look after themselves. Is that something anyone would like to chat about or has experience of? AHPs connecting to their community, for example?
Yeah, I mean, and just kind of, I suppose, building on the social prescribing conversation, and that recognition that you know, often when you're a healthcare professional and you're trying to help somebody about what matters to them, coming back to where we were at the beginning of this conversation, it's very often not the information about a specific health condition they need. It might be, you know, how do they access housing benefit, or sort out the damp in their accommodation, or deal with troublesome neighbours, or whatever. And that is the role that that social prescribing link workers can often help with. And so we produced a resource recently to try and help allied healthcare professionals see kind of where they fit on that spectrum of social prescribing, recognising that sometimes you may do some of that yourself in your role, either through very brief interventions or a more detailed conversation. But equally, there'll be other times when referring someone with more local knowledge and expertise and more time can be incredibly helpful, and can, you know, really help an individual to improve their health much more quickly than they would keep coming back and seeing you once a month.
Anyone else on that? Denise, in terms of education?
Sorry, Robin, can you just expand on that a little bit?
Well, yeah, just in terms of trying to encourage this kind of, I'm saying, social prescribing. I mean, it's been, I think with AHPs, it's also part of this role to make every consultation count, and make every connection a useful one in terms of a health promotional tool, as well as actually just looking at the issue you've come in with, taking opportunity as it arises. So is that something you teach? Is that part of how it's done?
Yeah, certainly. So I'm thinking one of our modules is population health and wellbeing, which is very much sort of working with communities, and I think that it is definitely kind of covered in there. But at RGU, our kind of assessment approach is very authentic. So the assessments that students undertake as part of demonstrating their learning outcomes are things that they would do in practice. So that, you know, how they would communicate. So we have sort of presentations or poster presentations, essays, case studies as well. So very much kind of applying the theory to practice.
Okay, so that's great. So that's happening. Fiona.
Well, as Linda's talking, I'm just reflecting on the conversation, Linda, that was generated by having the AHP public health strategy, the Four Nations piece that you guys led on. So we've been doing some work in Scotland on that, and I think what that has done is that's opened up the conversation about the AHP, both the strategic and the service delivery role, and that has implications for workforce planning, and it has implications how services are delivered and how roles are transformed, so that actually when we're talking about AHPs working within communities, within children and families, within, you know, older adult services, within learning disabilities, they can really start, I think, and I'm being really optimistic and hopeful in that the conversation that we're now having is the right conversations. Some of the roles can become much more front-facing, much more integrated into where they can have the, you know, a much greater impact. Not that they haven't been, but there's something much more about connecting to what really matters for some families who are living with diabetes or who are living with whatever particular health condition. And I'm thinking particularly of children. I'm thinking like speech and language therapists who are working, you know, very actively with children and families, but where, you know, if you get it right at that early stage, it has huge dividends right throughout the life stage, you know, in terms of health outcomes.
Amazing, yeah. So I just wanted to ask, I mean, we're getting nearer the end now, but I just wanted to ask something a little bit about what would be a big shift in attitude on healthy lifestyles that's needed, and how would that inform public health policy? Anything you could actually say would be the big thing that has to happen? All of you. Who would like to go first?
You need to get really serious about inequalities, really serious about inequalities, right? You know, I'll put healthy lifestyles to one side, but really come to this, all the things we've talked about tonight, but, you know, massively ramped up in terms of both our own home nations. And it's not just about individual organisations, but that has to be absolutely, you know, with us for the next 20, 30, 40, 50 years.
Yeah. Okay, and building on that, the community aspect of that, is there anything you could put in there that would actually help that community link to make that happen, to facilitate that? So it comes from the inside rather than just from the outside?
Yeah, I mean, I would say, I mean, it is about policy, and it is about recognising the social determinants of health and getting them into all the policies. But around some of the conversations we've had, particularly about AHPs or anybody working within a health in a really broad view of it, that is working with individuals, that there is always the opportunity not to just give information, but to help and support somebody at just the right time. Because my belief is that people want health, they aspire to health. Nobody wishes to have ill health, but it's got to be just at the right time for them. And that support, whether it's from the podiatrist, the dentist, the dietitian, the health visitor, just having that support and making sure the training for all of these allied health professionals really has a good component around how you have those conversations with people. I've been involved in the past, Robin will know this, in something called Henry, which used to be health, exercise and nutrition for the really young. And the central tenet of that was doing it at the right time, supporting people just at the right time. So you've got the bigger picture with the strategy and the smaller things that everybody who is working within a health environment can do on a daily basis.
So maybe actually be worth throwing, because we've talked a bit about schools, yeah, and intergenerational aspects of things, and we actually did talk with Linda a little bit about the police and interventions of different types where people get involved in health. So maybe, I mean, workplaces, hospitals, prisons and schools, but particularly, is there an opportunity there that's being missed, perhaps in prisons or in hospitals even? Linda, perhaps?
Well, I mean, hospitals is an interesting one, isn't it? Because I think, you know, whilst we're in the pandemic and we're still in a situation where, you know, visitors can't go into hospitals, hospitals have changed ever such a lot. You know, and I think, you know, the stories you keep hearing of people who are in hospitals and you know, the staff are struggling to provide just the basics in terms of, you know, a glass of water or a bit of information because of capacity. I'm hoping that as we move forward, we get a broader sense of kind of community within hospital environments, so that you know, visitors, friends, family, etc., are part of that journey of helping people to be well and to remain well. But that, I think that's more of a challenge at the moment than it has been.
So that's a bit of a block. I mean, it got to that point where there used to be very, very narrow visiting hours. Then they realized people getting visitors actually is good for their health. And then it's now gone backwards because of the pandemic. And what we've got to do sustainably is, I think what we've said before, is be able to revisit things that are a good idea and make sure they come back. Otherwise, we're kind of going backwards rather than forwards overall.
I mean, wrapped around all the settings, you talked about prison, talked about hospitals, is our prevention approach. It's similar to what Linda said about, you know, a public health approach to policing, a public health approach. It's absolutely central to all the settings and the settings within the context of the system. I'm also reminded that we're having a big conversation about a national care service. And, you know, again, not necessarily to get into the details of that because that's still in the early stages, but let's hope that there's elements of all the learning that we've had from the other parts of the system that we can bring into that, because that's a huge part of you know, improving health outcomes for so many of our population groups and that prevention and recovery agenda.
I think also the AHP agenda, being an AHP myself, there's 14 professional groups now, and it's an amazing thing to talk to AHPs and realise how much excitement and energy there is in that grouping. And I think, Linda, you probably have, and actually Denise as well, because you're training some of them as well. So either of you or both of you, how does that enthusiasm appear right now? Again, resources, exhaustion, fatigue from what's been going on. Is there still a willingness to go out there and make a difference to help?
I'm glad Denise is not nodding, because I certainly think there is, because all healthcare professionals, they come into their professions because they want to improve health for people over the long term, don't they? So everybody kind of gets the public health prevention argument. Nobody disagrees. So I think that passion is still there. There is an element of fatigue. I think that's fair to say at the moment, but that willingness and keenness to move on this agenda is absolutely there. And you talked, Robin, about the breadth of the AHP professions. I noticed people have, just put in the chat about physical activity in hospitals and art and music, and that, just prompted me to think of a lovely conversation we had just this last week with a music therapist who's leading the campaign around music for dementia, and how important music is as a kind of a therapy and a well-being activity, the right music at the right time for the right person. And I think that we've talked earlier on in the conversation about kind of the multidisciplinary nature of health, right from individuals, communities, through all of the different healthcare professionals and other sectors, and everybody has something to bring to this, don't they? And it's just I think that's the key.
Absolutely. Well, thank you. And Denise, is that something you're seeing in education?
Yeah, and just really building on what Linda was saying around the support that the workforce has given to our allied health professionals in training of what has been a really difficult and stretched time for the workforce, to enable them to still have these rich experiences and learning opportunities within the workforce in practice on their placements. I think. And
self-care, is that something, just because one of the questions came up about self-care of the health professionals, because at the end of the day, people are feeling fairly exhausted and burnt out. Is that something that is being looked after in the educational level as well as others?
Yeah, certainly. As an organisation, we've been looking at supporting students' wellbeing and resilience, throughout the pandemic. Definitely.
Because I think the first question we asked was, what does health mean to you guys who we're talking to and who we're talking with today? And I think that reflection between how you as a health professional connect with your own health and how it fits kind of has something a lot to say with perhaps what patients also might aspire to as well. Fiona, you were going to say something, I think.
Yeah, no, just again, Denise has talked about the sort of, the looking after the student welfare and well-being. I think no organisation, I'd like to think, has forgotten about that this last couple of years. I mean, certainly from a Public Health Scotland national agency right across the system, it's been a central sort of conversation. And I think the theme of it is signposting people to where they need support when they need it, but also there's a huge role for line managers and there's a huge role for the organisation just to help people stay connected. And that timely nature of that conversation it's hard to be prescriptive. So something might work universally for everybody, but there's also something about how you respond to that at that moment in time. And I think being on a front foot, maybe there is a silver lining in the COVID cloud, because I think we've got better at that. I'd like to think some of us have got better at it. We've been more in tune. We've tried to break down some of the barriers. We've developed stronger relationships with our peers and our colleagues and our teams. And I'd like to hope that we can keep that going, even though the COVID world sort of goes maybe to one side a little bit.
Absolutely, sounds good. So lessons can be learned, which is good. And I think are being this time around more than ever, perhaps. Sylvia, do you want to end up on anything near the end? So is there anything you want to sort of say as your big wish list? I know we've said about inequalities and communicating better. I think we've said very heavily, and looking after not just the communities, but also health professionals. Is there anything you want to?
Yeah, just really another point on helping the health professionals. We've sort of scooted over talking about healthy schools as settings, prisons as settings. And in a way, when you're talking about that, you are talking about the sections of the population that are going to go into hospitals, are in schools. But we really need to start with the people who are working in them in the first place. And I think hospitals is a huge example to get for a hospital to be a health promoting hospital. There are just so many things that should be in there in that environment for the benefit of the staff before a patient comes through the door. And it's very, very challenging to do, but that doesn't mean to say we shouldn't be striving to do it.
Yeah. So would you agree, just to finish up, are people striving and their hearts in the right places?
I think so, yes. I think people are, and I think if I look back on my career, I think health promotion, and that's what we're here talking about, is up for a sort of golden period now, because I think people are recognising even more, and COVID has brought this into focus, that actually medicine is not the answer to anything. It's what goes on in the community.
Fiona, do you have anything to finish up on?
I just endorse that. I think, you know, whatever we call it, in where we are in 2022, I think there's a lot to be gained from building our community assets, really thinking about our places, strengthening our connections, and being collective in that ambition.
So networking.
Absolutely.
Networking. And Linda, do you want
to?
to?
I think leadership is in there.
Leadership.
Yeah.
So leadership and networking are big. Yeah, and allied healthcare professionals are definitely trying to get on the leadership angle. Linda, do you want to just have anything else to say on that?
I mean, it's a different slant, but building on our conversation about the growth of digital, that also means that we've got lots more data than we used to have. So when we've talked earlier about health inequalities and knowing the needs of different communities and where we need to target our energy and support, I think we've got a much better picture than we have had in the past of where those needs are. So that is one advantage of an increasing digital world.
Okay, so that's good. So we're getting some information, we're getting the network, we're getting some keenness and leadership. Denise, would you like to add
the key thing for
next
me is just seeing the shift, I suppose, in my working career around how public health has really come to the fore, and how all the professions are really sort of seeing the importance of public health and working together. And I think, you know, COVID has really brought that to the fore, you know, even more.
Great. So profile of allied healthcare professionals, for example, making a difference. That's also quite important as well, and seeing their role growing, which I think I'm also delighted to hear, because I think it's an important contribution as well. I think I'm going to say, if that's okay with everyone, thank you very, very much to our panel for being so kind with their sharing and their knowledge. Really appreciate it. I want to thank also, if I may, the RGU for hosting this digitally, and the team there. That's very kind. Also the IHPE, of all of us as a team have put all this together. So very happy. And also I should thank our participants and their questions, and we've had lots of things going in the chat boxes, about 99 plus items, which perhaps will put somewhere useful for people to have a look at some of the comments and links that have been sent in as well. So we're getting some nice comments. People think it's thought-provoking, which is what we wanted, and that's great. And I think we've got a few outcomes which, when they're written up, which I'm looking forward to reading some of it, there might be something I think we've got a few things to end up on that are quite useful positives as well. So I think, yeah, thank you very, very much. And I'll say good night to everyone. And do look out for the videos on the IHP website and also on the RGU website when it's all pulled together. So good night.